Okay. Good evening, Chair Harrington and Board. As you stated, I'm Marni, Director of Health and Human Services. I appreciate your time tonight to provide this update. Before I start, I have a couple of really important thank yous to share. And I know that you have a full agenda, so I will try to be quick. But first of all, I want to say I'm the one sitting here in front of you, but there's a whole army of staff that are really doing the work. So it starts with our health officer, and as a reminder, in Washington County, we only have one health officer. And that health officer has had to navigate the day-to-day changes as we learn from the science, and we have to adjust our recommendations. She's had to help staff. She's had to advise healthcare providers. She's had to provide information to schools as this has rapidly evolved, the media, and to all of us. So I just wanted to say thank you to Christina Bauman, our health officer. The other is our nurses and our community health workers. The team here at Washington County was the first team in the state to have to work on this at a local level. They had to navigate a lot of this alone in the beginning when we were just learning about this novel virus. They had to deliver this news to people and their loved ones that had been diagnosed with COVID-19. The people that they were delivering this news to, they felt a lot of guilt, a lot of fear, and they experienced a lot of stigma. And our staff had to help them to navigate not only the disease and what they needed to do to protect themselves and their families, but all of these other issues because of this is such a new virus in our community. And then we have our epidemiologist and environmental health specialist. They had to keep reviewing the ever-changing, quickly changing, sometimes by the hour information so that we were always providing the most up-to-date guidance to our patients and to our communities. Our environmental health specialist had to work with restaurants and businesses to help them implement the social distancing requirements, and now they're working with our assisted living and nursing homes to help them as they navigate these outbreaks. I also want to say thank you to the county administrative leadership. They have supported us every step of the way, and you just have no idea how helpful that is to the staff that's working on this every day. They've been visible, they've helped us to navigate all sorts of issues, and they've provided a lot of support to the county across the board so that they can feel like they can take care of their families, they can come to work safely, and they have alternatives for telecommuting. I'm going to talk more about the EOC in my presentation, but I also want to say thank you to the board for your leadership. I think a lot of folks don't know out in the public what you did as a board to support this effort. And for me, the number one thing that your board did is they led with public health science, and they didn't let politics get in front of the public health science. That's really helpful. We weren't having to convince you of what the science was and what needed to be done. You jumped into action. You helped by sending letters to the governor. You helped with regional coordination with your peers. And you helped a lot with your videos and your social media messages. So you helped push those messages out that are really vital to us controlling this epidemic in Washington County. So I also just wanted to say thank you to you all. Okay, with that, I will start with the official presentation. So what I want to do is just provide a brief update of the situation, look at the OHA, the Oregon Health Authority trend projections, provide a review of the Emergency Operations Center that's been activated since March 2nd, and some of the new work that we've incorporated to ensure that we're using an equity and trauma-informed lens, and then just review what our public can do by staying home and staying safe. And some of these numbers are updated, even since we met earlier.
Let me trade you.
Okay.
Sorry.
Yeah, you're fine, thank you. There we go, okay. So in Washington County, the total case count as of this afternoon is 187 positive tests. We've had a total of 1,968 tests in Washington County. And that has an asterisk there because we don't know that every private lab test has yet been counted. So that number can fluctuate within hours. We've had 48 of our residents hospitalized and unfortunately 3 deaths. You can see in Oregon, the case count is up to 690. The total number tested, 13,826, and the total hospitalized reported as of late this afternoon was 154, with 18 deaths statewide. So I'm going to move on to the Oregon Health Authority statewide predictions for May 8th, and these are statewide predictions. So Oregon Health Authority epidemiologists and researchers recently completed a study of the epidemic trends of COVID-19 in Oregon. They provided estimates of current cases. They estimated 800 based on current testing number, the current number of positives, and they predicted the number of cases that would be hospitalized through May 8th. They used 3 levels of mitigation strategy to make their predictions. Before I go into these 3 levels, I want to say the most important message that was repeated over and over in their report is that in order to protect the health of our community, to save lives, and to ensure that our hospitals and healthcare workers are not overwhelmed with serious illness of COVID-19 patients, we must maintain the highest level of physical distancing that was put into place with Governor Brown's order on March 23rd. That's Order 2012. So the summary predictions for May 8th include this aggressive mitigation strategy that I just referenced, Executive Order 2012, and we can expect that if we, as a community, put that in place 90% of the time, 90% of our population, we can expect a cumulative number of 1,000 cases. These are statewide numbers. Just as a reminder, these are statewide numbers. If we only follow moderate mitigation strategies, such as those that we implemented earlier in March, like continued school closures and bans on large public gatherings, the prediction is approximately 6,100 cumulative cases. That number overwhelms our healthcare system. And if we went back to normal and we stopped our current social distancing and went back to opening restaurants and went back to social gatherings, then the prediction is 15,000 cumulative cases. The full report includes hospitalization predictions and it includes confidence intervals. I just gave you the medium numbers. So the full report is shown on the slide here. So what this slide does is show that visually, and I know it might be hard to see, but if you can see the green line, that is the goal. The goal is the green line, and that is full mitigation strategies, complete social distancing, staying at home if you can stay at home, and absolutely not leaving your home, isolating from others in your home if you're ill. And what you can see is that even with those strategies, it doesn't just magically end on May 8th. What happens is that flattens the curve, as you've heard. It preserves our health system so that we can care for those that still get ill and need hospital-level care, but there still will be the other side of that curve. And so it's much slower and a much fewer cases, but it doesn't mean that it ends on May 8th. Okay, so with that, I'm going to talk about what are we doing in Washington County. So in Washington County, we have an Emergency Operations Center. And our Emergency Operations Center has some underlying priorities and some objectives. So our priorities are to support and coordinate efforts to mitigate the impact of disease, That's about saving lives. We prioritize supporting people who are most likely to be heavily impacted by the COVID-19 disease with our disease control measures. So that's working with people who are houseless, our communities of color, people with limited English proficiency, and people that are in congregate settings like our long-term care facilities. We need to assess and mitigate the impacts of disease on the community, lifeline, and economics. So what that means is that people that are impacted need to have important daily living resources such as food and safe housing so that they can isolate. And they also need assistance with other economic impacts. If you're not working for 2 weeks, for some people that means they can't pay their rent and their mortgage. They're worried about their utilities being shut off. And so we're working with them to make sure that they're connected to the assistance that they need so that they can concentrate on recovering and protecting the rest of their loved ones. So the other thing is we need to support and encourage and facilitate and utilize our community's resilience and community support. We're working with hundreds of volunteers, nonprofits, businesses. We're all working together to support the families that are impacted, the families that could be impacted, and to protect our community from further spread and flatten that curve. Also, we want to be inclusive and ensure an equitable response, and so we're always looking to address stigmatization, racism, and making sure that our decisions are equitable and that one community is not impacted negatively. So we're always trying to think through what is the impact of that decision on certain segments of our population. So I wanted to go over one of our EOC functions is finance section. And the finance section has provided us projections through April 20th. So I think that what's important when you look at this slide is to understand that the federal government has issued a major disaster declaration for Oregon, and this will expedite our approval process for federal financial resources. At this time, the guidance has suggested that we would be reimbursed at 75% of our costs. In addition, we've received some public health grants that will help cover some of the cost of our staff and our public health functions, including some of the care that we're providing to people who are positive or people who are under investigation and not able to leave their homes. The other expense is that we have designed a respite shelter that will be available starting on Thursday, and I'm going to talk a little bit more about that when I talk about the services for our homeless populations. And the estimated full cost of the respite shelter, and that includes the contract with the hospital. It also includes things like janitorial services, room cleaning, laundry services, food, all of those things. So that cost is estimated to be about $559,000. So continuing on with our Emergency Operations Center, we have a branch that's called Operations, and this is where a lot of the work is headed. And so I want to talk a little bit about some of that work that's happening right now. So the public health branch is really the branch that's responsible for doing disease investigation, for tracking what's happening with those diseases across our community, where the diseases are, what are the connections, what can we do to prevent further spread. They're also the group that's supporting the people that test positive, their families, the people that are in quarantine and isolation, with meeting all of their daily needs, ensuring that they're getting the medical care that they need, and supporting their families and loved ones. The community service branch is working with all of our nonprofits and businesses to really ensure that their needs are met. So it's a two-way communication. We have weekly calls with local nonprofits and businesses to understand what are their needs, and then we work with them to resolve those needs, whether it's information, whether it's guidance from the Oregon Health Authority, whether it could be something as simple as a letter that they want to send to their constituents or their families. So we're just working to support all of those community organizations within Washington County. We also have a houseless branch, which I'm going to be talking more specifically about. We have an enforcement branch who's really focusing on the governor's order and how do we ensure that people are following that order, that they're staying home, they're staying safe. If they are an essential business, that they are following the social distancing guidelines. And we start in our enforcement branch with helping businesses understand what those guidelines are, helping them identify how they can implement those guidelines. And as a last resort, we would move towards citation, but that's really a last resort. And what I'm hearing from that branch is that almost everybody is very compliant. Once they understand what the need is, they're anxious to put it in place because they want to protect their own employees, their own families, and they want the community to get back up and running as soon as possible, and they understand that that means that they need to contribute by complying with these orders. The other branch that we have is the EMS medical branch, and the EMS medical branch is working on the alternative medical sites with the hospitals. They're also managing the growing COVID population of positive persons who don't have a place to go. So houseless folks or others that maybe have a home, but they can't because of the size of the home or the number of people living in the home, they're unable to safely isolate at home and protect their other family members. So they're working with us on finding alternatives for those folks. And then earlier today, I talked about the food mitigation, and we're now calling it Essential Services Branch because it's more than food. So we are certainly continuing to monitor the situation with food and food availability. We're working with Meals on Wheels people. We're working with the any food assistance program. We're trying to get out word about SNAP and that you can use SNAP for online food purchases now. But we're also working with folks to ensure that they can make those rental payments or figure out what they can do to stay in their homes. We're also figuring out what other financial assistance they need and trying to connect them quickly with how do you apply for unemployment quickly? How do you apply for Oregon Health benefit for your medical, to meet your medical needs? And so it's grown to more than the food monitoring, to really making sure that all their essential needs are met. And then the equity branch, which I'm also going to talk a little bit more about in a couple slides. So I'm going to try to answer a few questions that have been coming up. One of those questions is about testing. And we get a lot of questions about why aren't we doing more testing? Why aren't we doing more testing in Washington County? Where do I get a test? All of those kind of questions. So although more private tests are becoming available through the healthcare systems and through labs like LabCorp and Quest, we still have a limited supply of tests. And more importantly, we have a limited supply of licensed healthcare providers that can perform the test. And we have a limit, we're concerned about the need to maintain enough personal protective equipment so that if we have the surge of patients, that the hospitals, the nurses, the doctors, all the healthcare workers have that personal protective equipment when they need it. Each time a test is performed, it means you have a healthcare worker wearing personal protective equipment. So for that reason, we're asking that people that are not sick, that don't have symptoms, or even those with mild symptoms who don't need to seek higher levels of medical care, not be tested at this time. And I know that that's a tough message. Folks want to be tested. And even we talked earlier today as epidemiologists, if we had the ideal world, we would have enough tests for every single person that wanted a test to get a test, because it does help us to understand the disease and what is going on in our community, but we simply don't have enough. And so we're asking folks, if you're not sick or if you have mild symptoms, to please not pressure your healthcare provider or others to get a test. If you are sick, you should call your healthcare provider and talk to them about whether you need a test and how they want you to come into the office. Please don't just show up at the emergency room or another site. The other thing is you might be noticing some drive-through testing sites out at the Hillsborough Hops field. And so Virginia Garcia and OHSU are providing drive-through testing, but that is not for the general public. It's for their patients who have a doctor's order or for healthcare workers and first responders. If you don't have a doctor's order, you'll be turned away. So the last thing that I'll say about testing is a lot of times people want a test if they have mild symptoms, and right now we just simply don't have enough tests available, as I said, and having that test won't change the course of your treatment. There's no medication. There's nothing different that we would tell you other than what we're telling you now. If you have mild symptoms, you should stay at home. You should isolate yourself as much as possible from other family members, and you should treat yourself kind of like mom treated us when we were growing up and we had mild cold symptoms. Drink lots of fluids, make sure that you're getting plenty of rest, and try your best to cover your coughs and sneezes and really to stay away from the rest of your family. I know that's hard to hear. We all want to know the test results, but we just simply don't have enough right now. Okay, the other question that we've been getting is alternative medical sites. So I do have some new information on alternative medical sites that I'll share with you. But first of all, I want to just make sure that everybody understands alternative medical sites is really an umbrella term that we use for any alternative site. So it could be an alternative testing site. Instead of going to a clinic, you're going to a drive-through. Instead of having respite care, so you're ready to go out of the hospital, but you can't go back to the assisted living center, we might set up an alternative respite site. For our homeless folks, we're setting up an alternative respite site for people that aren't sick enough to be in the hospital, but they don't have a home to go to. So that's also an alternative site. And then there's also alternative hospital sites. Those are the mobile sites. Those are the sites like you've been seeing the ships that are coming into New York, into LA. So that is an alternative hospital site. So the new information that I have, even since this afternoon, is that Providence St. Vincent's has identified an alternative medical site at a church nearby their facility. However, they did stress that at this point, based on the projections and based on what they're seeing in their hospitals today, if we maintain the rigorous social distancing and staying home, they don't anticipate needing to use the site based on those current social distancing measures. So Tuwality, at this point, we don't know that they have an alternative site, but as a reminder, in the metro area, there is centralized command structure that's supporting all hospitals. And so if they got to a point where they needed it, they would work within that centralized command structure and would be able to access other alternative medical sites. And then I'm going to talk a little bit more about our homeless respite center soon. So business assistance, what I just wanted to make sure that folks know is that we're aware that our community is hurting, and we're aware that businesses are struggling, especially small businesses. So the county has put together a business assistance work group. The business assistant work group is led by John Southgate and Alex Vidal in our county administrative office. And it also has Commissioners Willie and Treese in that group, as you know. The group is coordinating with John Wheeler from our EOC to maximize the potential for any federal reimbursement. They're focused on supporting small businesses, and they're really looking to ensure that there is a DEI, a diversity, equity, and inclusion component to their planning. So homeless shelters and respite center. Again, an update even since this afternoon. So we have congregate shelters that are in place and some that are continued to be under negotiation but very near completion. In Beaverton, the Elsie Stir site is under negotiation, but the Beaverton Resource Center shelter is currently open 7 days a week through May 31st. Cornelius is very close to completing negotiation with St. Alexander and opening a shelter in Cornelius. And our next priority is planning for a Tiger Tualatin South County shelter. We're very excited to announce today that we have a respite shelter with the Comfort Inn and Suites in Hillsborough. The respite shelter will house up to 114 people who either have COVID positive tests or symptoms in one part of the hotel, and the other section of the hotel could house homeless who don't have symptoms. The lovely thing about having a hotel is that we can isolate individuals in their own room with their own showers, their own microwaves. People will not be leaving their rooms. They will not be congregating. And it's really a place that if you are COVID positive or symptomatic, the emergency rooms, the hospitals, clinics like Virginia Garcia will have a location where these folks can go and be cared for with dignity while protecting the community and really ultimately saving lives. The respite shelter will open this Thursday, April 2nd. So on to long-term care centers. We're very concerned about long-term care centers. These are very vulnerable populations, and we're very concerned about the staff who are caring for these folks. We do have one outbreak, as you've probably heard, at Regency Park. We also have what we're calling 8 clusters in different long-term care facilities. And what a cluster means is that there is at least one staff person or resident that has tested COVID positive or is symptomatic and suspicious of COVID because other things have been ruled out. So with these clusters, what we're doing in the assisted living centers have been fabulous. They're great partners. They really care about their residents. They're doing everything they can to prevent the spread. What we're doing to support them is we're really looking at when should we test residents and staff. It's not an automatic one person tests positive, we need to go in and test everybody. That doesn't work. It doesn't work because there's an incubation period and you can test negative today and maybe 3 days from now you're sick. And so we have to really look at what's going on in the organization, in the facility, to make the best decisions about who to test and when to do that testing. The other thing is we have prioritized their requests for personal protective equipment. And so we're getting those facilities the masks, those N95 masks that they need, and other gowns and gloves. Also, we've helped them with cleaning, with making sure that they have the ability to isolate ill patients. They're providing meals in rooms. So the patients, unfortunately, are very isolated, and that's really difficult. It's difficult for the families, it's difficult for the staff, and for the people that are isolated in their room. They all have policies of no visitors, no new admission, and staff are not able to work at multiple centers. And we're also helping them with information and to have conversations with family, with the residents, and with their staff, because as you can imagine, their loved ones are very concerned, and so we're trying to support that communication for all of the facilities. We have actually added new staff, including consultants, to the EOC to help with this, and our environmental health staff are also going out and helping with some of these isolation, because it sounds pretty simple, but sometimes it really means rearranging patient rooms and how you're doing patient care. So then on to equity and a trauma-informed lens. So we now have an equity chief officer in our EOC, Pusen Mint, and we're very grateful to the work that she and others, our public information staff and Pusen, have done. So one of the things that we've done is working with Western Farm Workers Association. We've been able to visit plant nursery workers and some of our migrant camps that have year-round inhabitants. We provided food, personal hygiene supplies, and COVID-19 prevention information. We also send out bi-weekly email to over 350 partners in both English and in Spanish, really asking what are their needs and identifying those needs and then providing them the resources that they've requested. We're also sending bi-monthly surveys to our community organizations, the same 350 organizations, again, asking them what do they need from us so that we're in constant communication. We've done paid Facebook ads in Spanish and in English to try to help get information out. We've done mailings and check-ins with the partner organizations. And then as far as our trauma-informed lens, as you saw in the beginning when I talked about the staff and all that they're facing, we wanted to make sure that staff are taking care of themselves. Some of this work is emotionally difficult. People are angry because we can't do everything as quickly as they want. Patients are afraid, and we're trying to give them reassuring information, but our staff are hearing about all of this. One of the stories that I wanted to share with you to show you how far-reaching this is, our medical examiners had an infant death, and the family was trying to find a funeral home so that they could go through the grieving process, and all the funeral homes were afraid. The infant had respiratory symptoms. They thought maybe the infant had COVID, and the family was running into barriers. Our medical examiners found out that the child was not COVID positive, was able to share that information, and was able to work with the family to find a funeral home so that they could begin the grieving process over their infant child. So this can be really, really tough work across the department and across the county. And so we wanted to make sure that staff have a wellness room, which we've set up in the EOC. It doesn't look like much, but it's a place where they can go and get away from the noise and the bluster of all that's going on. And we also have self-care stations where they can go and get fidget toys and snacks and treats just to try to take care of themselves. So finally, what can we all do? And this is for all of us and all of the public that may be watching this. What we're reminding you and asking you is please stay home and stay safe. If you can stay home, absolutely, please do so. Telecommute. Don't go out if you don't need to go out, other than maybe some outdoor activity where you're keeping your social distance more than 6 foot. So if there's a trail that's not heavily doesn't have a lot of people, then get out and take a walk, enjoy the outdoors, but please keep that 6 feet of distance from anybody that's not in your immediate household. Washing hands frequently, using your hand sanitizer when you can't get to warm water and soap. Washing surfaces, because we know the virus can live on surfaces, so using sanitizers and washing surfaces. Avoiding touching your face, nose, and mouth. Cover your coughs and sneezes. I know that our kids are really good at that. You can see they're just automatically not using their hand, but using their coat or into their coat if you don't have tissue available. And then, I can't say this enough, stay home and avoid others if you're sick. Even if you have mild symptoms, please stay home and avoid others. Our public information officers and all of you are really working hard to get that message out, so we appreciate them and the work that you're doing. And with that, I would answer any questions.
Commissioners, any questions?
No, that was an excellent presentation.
It
Thank
was very good.
Thank you.
Thank you.
Thank you.
The reason we don't have any questions for the viewing audience, it's the second big presentation today and relatively the same information. You guys are doing terrific.
Yes, thank you. Thanks for
Commissioner
all your
Treese, do you
support.
have any questions or comments?
I don't have any questions. Thank you, Chair, but I do want to once again thank Marni and her staff for all the work that you're doing and the hard work, the emotional work, and I just couldn't be more appreciative. Thank you very much.
Thank you. I'll pass that on to the staff.
I would just like to add to you and all of the staff, not just staff who are involved with the EOC, but to staff all across the organization. Thank you for helping us make public health informed decisions, but also to continue our work together. The work that Commissioner Willie and Commissioner Treese have done with John Southgate and Alex Vidal on scoping out a business assistance program, doing research and practicing the art of the possible. We were able to go over that in work session today, is just an example of the kind of ideas that we're trying to explore and run with as our community is faced with a tremendous crisis here that none of us have had to deal with on this scale with the uncertainty. I'm really looking forward to using this base case information as you showed us in the charts, having perhaps a flatten the curve peak around May 8th. That's 9 weeks from the behavior change date. And if we take the flip side of that, another 9 weeks, that takes us out to about July 10th. So it's like, okay, we've got a few months of this if all goes well. And, you know, it may not, but at least now we have a set of information that can be modified and that we might be able to hold out some hope for and look forward to, as opposed to just the great unknown and uncertainty. One thing is clear, we're all in this together. Staying home, saving lives is what it's all about, and that's our top priority. So thank you again for all of your work.
Thank you.
Madam Chair, just to show a little appreciation, item 6 tonight's an action item that should be relatively short, and Marni and crew have been working endless hours. I suspect she'd like to get on the road, so if the board would indulge, it'd be nice just to take that item and allow you to get home.
Do I hear a motion?
I so move, Madam Chair.
Second?